So having spoken about assisted reproductive technology, we just want to move into what we spoke about infertility, right? So said that one of the ways of tackling infertility is using assisted reproductive technology. So we look at this assisted reproductive technology and we look at the various types you have and the applications of this assisted reproductive technology. So it simply means you are using medical procedures, so that it can be able to help individuals or couples to conceive, when the natural process to conceive is difficult for them or impossible for them, right? So the techniques just involve handling eggs, handling your sperm, handling embryos outside the body. Alright, so you handle them outside the body before you put them into the body. So this will basically increase the chances of the woman getting pregnant. Okay, so what are the common types, which is the most important part of this lecture? You can have what? In vitro fertilization, like you take the egg from a woman, in vitro, so the eggs are retrieved from a woman, right? So you take them out, you fertilize them outside, before you transfer the fertilized egg into the uterus. Then we have the intracytoplasmic sperm injection. This one you are putting what? A sperm right into the egg. Alright, of course, there should be fertilization, of course. You're helping the sperm get there. This is when the sperm cannot get there on their own, So frozen embryo transfer, egg or sperm donation, alright, used when one partner cannot produce viable gametes, So gestational surrogacy. This is when maybe you fertilize a two couple, but you transfer the fertilized embryo into another woman, maybe because the other woman cannot keep up with pregnancy. So what we got here is, for success depends on several factors. Now some of these factors is the age of the person. If the person is young, the more the success rate. Cause of infertility, what actually caused the problem, alright, depends on whether it will be successful or not. Clinical experience of the person doing it, right? So that does it. So risks and consideration is multiple pregnancies or more, ovarian hyperstimulation syndrome, emotional or financial stress, ethical concerns around embryo selection, all of that. So this is a possible cause, alright. Not really part of our lecture, but at least you can just have an idea of how much it actually costs for you to actually have this assisted reproductive technology.